So AI is completely changing the game in healthcare, right? But it brings up this huge, huge question. How do we protect the very foundation of medicine, which is patient trust? It's all about striking that critical balance between adopting amazing new technology and protecting data, which is an absolute must. Let's dive into how that can actually be done.
And that's where a new kind of technology comes into the picture. Today, we're going to focus on one example called MedAI. Now, this isn't your generic one-size-fits-all AI. Not at all. It's a platform that was literally engineered from the ground up for the incredibly unique and high-stakes world of healthcare. Okay, but before we even touch on the cool features and all that, let's just get real about the number one concern here, the data. I mean, we're talking about the most personal, most sensitive information a person has. So that instinct to guard it fiercely, it's not just understandable, it's absolutely essential.
And this quote, it just nails it. You're right to be cautious. That caution isn't some roadblock to innovation. It's actually the prerequisite for getting it right in medicine. It has to be the starting point for any conversation about new tech. So this is the tightrope every healthcare leader is walking right now, isn't it? How do you tap into the incredible power of AI to make things better, to improve outcomes, without compromising even an ounce of the trust your patients have in you? It's a really delicate balance. So how do you actually do that? How do you strike that balance? Well, the answer isn't about slapping a security patch on some old tech. It's about a totally foundational approach. It's about building the solution with healthcare data security in mind from day one. And this is the key takeaway right here. It's built for healthcare from the ground up. That's not just a marketing slogan. It means it wasn't an AI designed for, finance or retail and then kind of tweaked for medicine. No, its entire architecture was designed around the very specific rules and ethics of healthcare. Okay, so built for healthcare sounds great, but what does that actually mean? What does it look like on a practical level? Well, it all comes down to a principle called security by design. The idea is that protection isn't an add-on, it's the very foundation. Let's take a look at the pillars holding it all together. So let's break this down. First off, a HIPAA-focused design. That means compliance isn't an afterthought. It's literally baked into the system's DNA. Your data is protected by encryption, both when it's moving and when it's just sitting on a server. And this is a big one, role-based access controls. Think about it. A billing specialist doesn't need to see a patient's entire clinical history. This feature makes sure people only see what they absolutely need to see, which minimizes risk. And with audit trails, you get a full record of every single action taken. Total transparency. And to really get why this all matters, we have to be super clear on what we're talking about protecting. It's called PHI, or Protected Health Information. Basically, any piece of health data you can tie back to a specific person. MedAI's whole reason for being is to be a fortress for this specific kind of data at every single stage. So let's follow a piece of data for a second. The moment it enters the system, boom, it's encrypted. Think of it like being sealed in a digital armored car. Next, only the people with the right keys, those role-based permissions we just talked about, can get anywhere near it. A nurse sees what a nurse needs to see, and that's it. And finally, every single time that data is touched, it's logged. That transparency creates accountability and makes security something you can actually prove. All this tech talk, encryption, audit trails, access controls, it's easy to get lost in the weeds. But here's the thing. They all serve one single ultimate goal, and that is the trust imperative. And this really hits home. This isn't about technology for the sake of technology. It's about a fundamental human expectation. Patients give you their most private information, expecting that you will be its fiercest guardian. That is the absolute bedrock of the entire patient-provider relationship. This really puts it in black and white, doesn't it? On one side, you've got tech that's a black box, creating mystery and risk. On the other, a system with transparent audit trails. You have generic, off-the-shelf security versus HIPAA-focused controls. The choice you make here directly decides whether you're building up that patient trust or slowly chipping away at it. Look, we know a quick explainer like this can't possibly answer every single question you have. Your hospital, your clinic, you've got your own unique workflows and compliance needs. And that's why this isn't just about presenting information. It's an invitation to have a real conversation. And getting those answers, it's not some huge commitment. We're just talking about 15 minutes. So the call to action is simple. Book that session. And I love this part. Bring your toughest questions. That's not the kind of thing a company says if they're trying to hide something.
That's a team that is confident in what they've built and is ready to prove it. So I'll leave you with this one final thought. It's really the only question that matters at the end of the day. Take a hard look at the technology you're using right now and the tools you're thinking about for the future, and ask yourself, honestly, is this building that bridge of trust with my patients, or is it a crack in the foundation? The answer to that could define the future of your entire practice.